things that I learned in a book, I've actually done it in real life. Just so you know, the meeting is being recorded, so if you don't want to be seen, you can keep your camera off. Now, I did say I am a Cofective consultant. Some of the information we are using today is from the Cofective Breastfeeding Education System, but they are not paying me today, which is why I have no disclosures or conflicts of interest. So today's class objectives, we are going to get rid of the myths regarding breastfeeding. I do that every single time I teach. Discuss the importance of exclusive breastfeeding, meaning your milk only, no other outside foods for the first 6 months of life. Educate on the risks of formula feeding, something that a lot of breastfeeding classes leave out because everybody wants to talk about breast is best, but they don't talk about what happens when you give the alternative. We're going to talk about preparing for labor today, even though this is not a childbirth education class. What happens during labor is very important and has an effect on how breastfeeding gets started. Different comfort techniques you can use during labor, non-pharmacological techniques, meaning no drugs. Where to go for evidence-based information regarding breastfeeding. Answer any questions or concerns you may have, and we're going to talk about breastfeeding during COVID-19. So, all right, the most important thing I want you to understand today is that you need to let labor begin on its own. Babies come when they're ready, okay? Not when you're ready, not when you're tired and heavy and can't sleep and can't get comfortable and it's hard to breathe and you have heartburn from drinking water, but when they get ready. It's very important to let labor begin on its own. Babies' brains grow significantly in the last 2 weeks of pregnancy, and their lungs. Their lungs are the last thing to mature. That's one of the reasons why preemies usually have issues with respiratory issues. They have to have oxygen and stuff like that because their lungs are not ready. And this is something that is really cool, is that the labor does not start because of you hit the date that your doctor guessed, because a due date is a guesstimate. Babies can come 2 weeks before or 2 weeks after that. But there is a chemical that babies' lungs release when they have fully matured that triggers your body to go into labor. So starting labor early, having it induced, any of those things can make it less likely that baby will be able to breathe on their own when they come. So that's something to keep in mind. So how long does labor last? Wait a minute, I'm sorry. I'll make sure that I'm looking at the right thing. Okay, so how long does labor last? So for first babies take longer. Obviously, your body has never done this before. It takes a lot more work to get it ready. So early labor, which is the first phase of labor, can take 6 to 12 hours. Early labor, stay home, okay? Don't go to the hospital when you feel your first contractions, because you will be there forever, or they'll send you back home. Stay home, walk around, eat something, because a lot of hospitals, even though ACOG, which is the American Academy of Obstetricians and Gynecologists, says that you can eat during labor. I'm sorry. Did you have a question? Okay, can you mute yourself? Okay. There we go. Okay, so some hospitals still won't let you eat during labor. And when you think about it, labor is like running a marathon laying down. So you need that fuel, you need that energy, especially if you might be in labor for up to 24 hours with a first baby. So you want to make sure that you stay home, you eat, you relax in that first part, that early labor. Active labor is from 4 to 8 hours. That's when things start to get serious. That's when early labor is when your cervix is going from 0 to 5. It hurts. but it's not terrible. But once you get into active labor, that means that the contractions are coming close together, and it's painful enough where you cannot talk through them. Then it's time to go to the hospital. So you want to get to the hospital during that point. But just remember, the process can take 12 to 24 hours. With the second baby or later, they tend to go a little bit faster. Your body has done this before. It's had practice. So things move a little bit more quickly. Early labor with a second or later baby can actually start 1 or 2 weeks early. If you've heard of Braxton Hicks, those are your body's practice contractions. That is basically working on getting the cervix open, warming up the engine, so to speak. And they tend to happen more in later pregnancies. And so you can actually start to dilate in those first, those early contractions. 1 or 2 centimeters, it's totally normal with a second or later baby to be dilated 1 or 2 centimeters in a week or two before your due date. That does not mean that baby's going to come a week or two early. It just means that your body's getting ready so that the second stage of labor won't take as long. I can tell you with my youngest, I was 2 centimeters dilated for about 10 days before he actually came. I do want to tell you one thing: if there's a big space between children, second labors can last just as long as first labors because your body is out of practice. I labored for 17 hours with both of mine. They are 8 years apart. So that's something to keep in mind. But normally if you have, if there's a shorter space, 5 years or less between babies, it usually takes 6 to 12 hours. And the afterbirth pains are much stronger with the second baby, and that's because the body has done it before, which means your muscles have been stretched out before, and it takes a little bit more effort for them to contract back down. I like to always tell that part because you tend to have contractions when you breastfeed, and those first few days can be kind of difficult with the second baby or later. So I like to warn people about that. So what happens during labor can affect breastfeeding initiation. It's like a snowball rolling down the hill because one thing can lead to another. If you get your membrane stripped, which is something that some obstetricians will offer you, not as likely with your midwife, though some will, but that's basically moving the sac away from the wall of the uterus to kind of try to stimulate contractions to start. Remember, contractions are not supposed to start until your baby tells your body that they're ready to breathe air. So that can start labor artificially early. They strip your membranes, okay. So you start having some contractions, but they're not really good contractions because your baby's not actually ready. So then it's like, oh, okay, well, we stripped your membranes and you're, okay, you dilated about 1 or 2 centimeters. Let's go ahead and induce you with Pitocin. Pitocin is an artificial hormone that mimics what your body makes. Your body makes something called oxytocin, and it's what causes contractions. It's released when you nurse your baby, which is why your belly goes flatter faster when you breastfeed. It also helps to bring your milk out. It triggers the milk reflex, but the artificial version is much stronger than the natural version, and so it can cause artificially strong and close together contractions, which means it makes labor much more difficult to handle with natural methods. It makes it much harder to go without pain medication. So then you're having these Pitocin induced contractions, and because your body wasn't ready, it can also make labor take longer. So you're in all this pain, you're like, you know what? I can't take it. Give me an epidural. Okay, so you get the epidural, which does help with the pain, but it can slow things down. And then you end up with failure to progress, because once you get the epidural, you cannot move. You are strapped in the bed. You have to be monitored. And they have to monitor baby because an epidural is it's actually a narcotic pain medication. And it can cause baby's heart rate to slow down. So now your contractions are coming slower, and they may be what they call disorganized, where they're not coming, instead of, every 60 seconds, every 45 seconds, you might have, 2 in a row, 30 seconds apart, and then a minute and a half, and then 2 more that are 20 seconds apart, and then 2 minutes. And so you're not progressing the way they want you to. So now you have failure to progress. Oh, and you can't move around, because moving around helps contractions to come like they're supposed to, helps baby to come down. Gravity is helping you, because you're strapped in the bed. You don't have any gravity to help you. You can't move around. Failure to progress, fetal distress, baby's heart rate's dropping. Now you're going in for an emergency C-section. Okay, so you see how all of those things can turn into one big mess. And a C-section, or a baby that's been drugged from an epidural, can make breastfeeding really difficult. Okay, so that's something you want to keep in mind. So, what do you do for the pain? If you're not supposed to have drugs or an epidural, what are you supposed to do? Walking actually can help to speed contractions, keep them regular. Gravity, because you're standing upright, helps to bring baby down so that their head is pressing on your cervix, which helps your cervix to open better and faster, which can help to speed labor along. You want to do your breathing exercises. If you have not taken a childbirth class, I highly, highly, highly recommend that you do so. If for nothing else, just to know what to expect, because knowing what to expect can make things a lot less scary. And when you're in pain, fear does not help. So knowing what to expect can make things a whole lot easier. Change positions. That's one of the reasons why epidurals not so great, because once you get it, you're strapped in, you're on your back, that's it. If you can get on your hands and knees, turn on your side, use a birthing ball, which is what you see here in this picture. It's like a giant yoga ball or something, where you can just kind of rock and bounce on that. It helps the hips to open up so that baby can come through easier. Get a massage. You see how daddy is rubbing her back here. Get a massage. A tennis ball rolling on the small of your back can help. A warm shower or a bath, as long as your water is intact. Once your water breaks, you cannot get into a bathtub, but you can shower. The warm water can help. It's almost like a massage. It can help to relax you so that, it's not as painful. But walking, and having your champion give you a massage is great. Or get a doula. How a doula can help. So what is a doula? A doula is a woman who gives you guidance and support during pregnancy and labor. So you usually meet them somewhere midway through your pregnancy. You discuss your your plans, your labor plans, or whatever. And a lot of people think, well, I have a champion. My partner's going to be there, my husband's going to be there, my grandma, my best friend, my sister. What do I need a doula for? Your grandma, your sister, your mom does not know the process the way that a doula does. And a doula's only job is to pay attention to you and do what you ask them to do, and to basically be the liaison between you and your medical team. Your partner may be flustered. He may be upset from seeing you in pain. Your mom is not happy because her baby is hurting. And so they're distracted, where your doula, her only job is to help you get through labor. And multiple studies have shown that when you have a doula, you are less likely to have a C-section. There are lower rates of forceps or vacuum-assisted delivery. That's when they actually have to pull baby out. You're less likely to need Pitocin, which means that your labor is progressing normally. You're having good contractions. Labor tends to be shorter, and they can help you get breastfeeding off to a good start. So you don't have to have a professionally trained doula. Some people, have a second person with them. Right now with COVID restrictions, it can make it a little difficult, but here in Michigan, Governor Whitmer did make a declaration that says that doulas are considered part of the medical team, so they're not considered a visitor like they were in the beginning. They were being blocked from being in the hospitals with moms in labor. So now they're considered part of the medical team. So if you do choose to get a doula, you should be able to have her with you to help you get through labor easier. So, all right, you're like, okay, I got my doula, I took my childbirth class, I'm ready. Where do I find evidence-based information? Where can people help me get this breastfeeding thing off to a good start in the hospital? Well, there's always WIC, the Women, Infant, and Children program. Even if you don't necessarily qualify to get WIC services, you can usually attend one of their support groups or classes, especially now that everything is virtual. Then there's the Maternal Infant Health Program. If you receive Medicaid, you automatically qualify for an MIHP. An MIHP is a team approach to helping moms get through pregnancy. They usually meet with you as early as possible in your pregnancy, and they stay with you all the way through baby's first birthday. So there's usually a social worker, an RN, and a dietitian, an RD, on the team. Sometimes they have an IBCLC on the team too. And they actually make home visits. They come to you. You don't have to go anywhere. And it's usually like once a month. All three of them don't come every month, but they rotate. They can help you find baby supplies, cribs, diapers, make sure that you make it to your to your doctor's appointments, answer any questions you may have. When baby comes, they'll do weight checks on baby, make sure that breastfeeding is going well, all those kinds of things. So MIHP, really good program, available to you at no cost if you are Medicaid qualified. The Nurse Family Partnership is exactly like the MIHP, only the difference is they only service first-time moms. So the Nurse Family Partnership has an RN that comes to see you throughout pregnancy until baby's first birthday, and it's only for first-time mommies. But they give you all that support that you would have gotten from an MIHP. Then there are breastfeeding support organizations like there's BIMFA, which is the Black Mothers Breastfeeding Association, SEMI, which is Southeast Michigan IBCLCs of Color, La Leche League. There's Meet Nurse Love, which is based in Oakland County, but anybody can come to the meetings. It's just that the meetings are based in Oakland County. Who else? And the Mother Nurture Breastfeeding Support Organization, which is based in St. John, Maine. They have a breastfeeding support group through there. And then there are skilled lactation providers, your peer counselor, your CLS, CLE, CLC, IBCLC, all of the alphabet soup of lactation support. So let's talk about a breastfeeding peer counselor. A peer counselor is a mommy who has personal breastfeeding experience and is trained to provide basic breastfeeding information and support to other mothers. They tend to share a language, be from the same area, and share the same culture. I actually started out as a breastfeeding peer counselor. Like I told you in the beginning, I breastfed my kids for almost 4 years total. So I have personal breastfeeding experience, and I really wanted to be able to help other mommies breastfeed too. So a peer counselor will be able to help you with normal breastfeeding questions and concerns. They can give you one-on-one information, or they lead breastfeeding education classes and support groups through WIC and other community-based breastfeeding support organizations, some of the ones that I listed before. And they can help you if you have just like regular questions, like, does this latch look good? Does it seem like baby's getting enough to eat? How do I know that they're getting enough to eat? Is everything going good? Breastfeeding peer counselor can help you with that. If you're having some minor issues like some pain with latching, they can give you some tips on how to change that, how to move baby around and stop that, and things of that nature. If you are having major issues, that's when you move up to a skilled lactation specialist or a lactation consultant, an IBCLC. They have clinical expertise in the management of breastfeeding difficulties. So, and IBCLC is considered part of your medical team. They are part of the healthcare team. They can, you know, talk to your doctor, your OB, the baby's doctor, the pediatrician. They give evidence-based care. Evidence-based, not what they think, not what they feel, but things that are backed up with scientific research and studies. Evidence-based care. They are certified by the International Board of Lactation Consultant Examiners. They work in the hospital and out in the community. And they advocate for breastfeeding families. So if you are having issues and you don't feel like your healthcare provider is listening, or you need you know, information on how to approach them about something that you want to do that they may not necessarily be in agreement with, like a medication that you're on, or continuing to breastfeed once baby starts solids and things like that, your lactation consultant can give you the evidence-based information you need to discuss with your doctor. I want to point out that most physicians have little to no breastfeeding training. Most medical schools only require like a one-day rotation with lactation, which means that in 4 or more years of medical school, they spend about 24 hours getting breastfeeding education. So when you are looking for evidence-based care for breastfeeding, you want to talk to someone who actually has training in breastfeeding. Did I skip something? Okay. Breastfeeding and COVID. Breastfeeding and COVID-19. So, breastfeeding should be initiated regardless of your status. If you are infected, if you think you're infected, if you've been exposed, doesn't matter. You need to breastfeed. Okay? You need to breastfeed because if you are ill or if you have been exposed, the antibodies that are in your milk can help to protect baby from illness. There's actually a study going on right now, an international study about the antibodies in breast milk as a possible treatment for COVID-19. So mommy milk is awesome and babies need it, okay? If you do have symptoms, you want to use a mask and practice good hand hygiene. Wash your hands before touching baby or your pump. Make sure you have the mask on, but you can breastfeed directly. And the most important thing is to protect breastfeeding and your milk supply at all costs. So if baby is sick or early, or if you're sick, you still need to be able to pump so that baby can have access to your milk, because your milk can literally be a treatment or a protection. Then you also want to make sure that you're getting your information about it from reputable organizations that are breastfeeding friendly and educated. So the World Health Organization, the Centers for Disease Control, WIC, United States Breastfeeding Committee, all of those places keep up to date on the research that is going on and can give you guidance on how to proceed if you think you have been infected or exposed. So you want to make sure you get ready. Let labor begin on its own so that baby's brain can grow, so that their lungs can be ready, so that you can have an uneventful labor without surgical interventions, and so that breastfeeding gets off to a good start. Okay, and I'm going to stop sharing. Oh, we've had some more people join in. I see names I don't recognize from last time. If you want to go ahead and introduce yourself, you can either unmute yourself or type in the chat if this is baby number 1 or later, how far along you are. And then we can move on into questions. I see. I think Ola was here last time. See, Anne Eunice and Ileana.
Hi, this is Ileana. Do you want us to introduce ourselves?
Yes.
Oh yeah. This is Ileana. I was due on the 10th, so I'm overdue by 2 days now. And I have a scheduled induction for Friday. So I'm sort of staying patient and relaxed as much as I can. And this will be my first baby.
Okay. And I see somebody else just put in first baby in the chat. Who is that? Who just put in first baby? Oh, where's my, okay, there I go. Anne is having baby number 1. Due any day now, okay. Eunice, you can either unmute or put it in the chat. And if you would look in the chat and see, we do have a survey that we need you all to fill out. It's only like a couple questions. It'll take you less than a few minutes, just to make sure that we are giving you the education that you need, and to make our funders happy in the grant office. But the link is right there. It's a Google survey that you could fill out right quick. Eunice, I'm not sure if I'm saying that right.
Yeah, hi, I'm Eunice. my little one is like make noise, so I need to make myself. Yeah, yeah. My due date will be next year on March, and this is my 4th baby.
Okay.
Yeah.
Did you breastfeed with your others?
Yeah. The last 3 are breastfeeding. Yeah.
Wonderful. And let's see. Anne, you typed in. So first baby due any day. All right. Do you have any questions, concerns, anybody? Was there something that you missed that you wanted me to go back over? Because with my, when I was sharing the screen, I couldn't see when people joined, so I don't know if you missed anything important.
This is Ileana. I have a question. After delivery, is it a practice to breastfeed the baby immediately after, or how is the baby fed?
Absolutely. As soon as baby comes, they go straight to the breast. It's called the magic hour. And if do you know where you're going to deliver?
I'm actually in DC, in Washington.
Oh, okay.
Mm-hmm.
So if it's a baby-friendly hospital, they do it automatically. If hospital is not baby-friendly, you can have that as part of your birthing plan, that you want baby skin to skin immediately after delivery. That does a couple things. It helps baby get used to being out here in the world. It brings their cortisol levels down. That's their stress hormones. It regulates their heart rate, their breathing, their body temperature, all of those things just by being skin to skin with you. It tells your body that the baby is out, so that it can help to expel the placenta easier, and helps you to reduce your risk of hemorrhage. It also brings your cortisol levels down, and it puts baby close to the food. So they should stay skin to skin with you for that first hour or until the completion of the first feed. If you have an unmedicated delivery, babies will usually eat and be done within that hour. If you have a medicated delivery, if you have an IV with pain meds or an epidural, or a long, rough labor, it can take a little bit longer for baby to get, get themselves together and get ready to eat. But you want them skin to skin until at least the completion of that first feed. In DC, I'm pretty sure they don't have any baby-friendly hospitals. I have a friend that's in the DMV, and I just remember her struggle with her babies trying to get the hospitals to do the things that she wanted to do. So just make sure that you have your birth plan together and that your champion, your partner, whoever's going to be there with you knows what you want, because you're not always able to communicate effectively right after you have a baby. So you want to make sure that they are able to give the team the information so that you can have the birth experience that you want. And I see Ola put in the chat that your OB suggested that you get an induction at 39 weeks. Are you high risk? Are you having some kind of issues?
Nope, no issues, nothing. She was just saying that since it's a first baby, it might take longer for the baby to start, like for the labor to start on its own. So she was saying that she suggests that I get an induction at 39 weeks. So what do you recommend?
My professional opinion is no. I don't have your records in front of me though, so I can't really speak to it. But my professional opinion is, unless there is a medical reason, unless there is a medically indicated reason, sometimes, like if mom has gestational diabetes, baby can be big, and so they'll want, they want to bring baby early so they don't get too big, because the larger the baby is, the more it can increase your risk of C-section. Or if baby's too small, if baby's small for gestational age and they're worried that they're not growing well, they want to get them out so that they can start to catch up. But if there is no medically indicated reason, labor should begin on its own.
Okay.
That's evidence-based information.
Thank you.
Okay. Anybody else? Let's see. And this is baby number 1. You don't have any questions? No concerns? Nothing you want to know more about? No? I don't know if you're talking because you're muted. I am. Great. And my Zoom is not responding. Awesome.
Oh, Tameka, I thought of a question.
Okay. My screen froze, so I don't know if anybody was talking.
I just started. So you were talking about doulas. Do you know what should you look for in like a reputable doula? How should you start the search? Like, where should you search online? Is there a good website?
There are several local organizations. BIMFA has a doula program, but they are specifically for Black moms. Then there is DONA, D-O-N-A, that is a doula certification, program. So if you go to their website, they should be able to, give you a list of doulas that are local to you. I recommend checking like mom boards, like different social media, because really the best advertisement for doulas is word of mouth. I know several doulas in the Metro Detroit area. And then there's also Birth Detroit, which is it's a midwife-run prenatal and birth clinic for moms in the Metro Detroit area, and they have a doula on staff. There's also, if you look up birthing centers, they usually have doulas. There's 9 Short Months. Detroit Mama Hub. I can type this stuff in here. Oh no, I can't because my screen is frozen and it's just circling and it won't let me type. But Detroit Mama Hub could be a good place to look. DONA, D-O-N-A, which is, I can't remember what the acronym stands for, but I know that they certify doulas. And then Birth Detroit, all of those places, and 9 short months. Those 4 places you can look to at least get directed to where to find a doula. This is crazy. You can hear me talking, but I cannot, my screen will not let me type or move or go back to my slideshow or anything. Interesting. Okay. Did anyone else have any questions, concerns? And just, I did want to touch on this. Ola had said that her OB suggested an induction at 39 weeks to decrease chances of a C-section. But remember, your due date is a guesstimate. You might be 39 weeks, you might be 37 weeks. And babies' brains and lungs finish maturing in those last 2 weeks. And so if labor has not begun on its own and you don't have any medical issues, you know, induction can actually, well, it definitely lengthens labor. It lengthens labor, and depending on how they do the induction, it can actually increase the risk of C-section. So that's just something to keep in mind. Induction usually takes, if baby's not ready, it usually takes about 24 hours. So the same length of time that it could take for natural labor. So that's something to keep in mind. Can't I type anything? So frustrating. I don't know.
Okay. Are we good to end it here?
Okay. So I can't hear or see anyone right now. I don't know if you can hear or see me. But if there aren't any other questions, we can go ahead and wrap up. I do want to make sure that everybody does answer the